The good member from the 25th, Representative Jacobsen.
Madam Speaker, medicine sometimes gets it wrong. And there are people, Madam Speaker, who maybe have alternative health ways that they live. I mean, my family doesn't even eat soybean oil. We're very careful, but we don't get the flu vaccine either. So when COVID-19 hit and there was a vaccine available, our thought was to continue taking our vitamin D and to do all the things that we knew to do and to not get the vaccine. So if you can remember back to that time, we at that time lost a good portion of our state patrol. My key card, my swipe card to the legislature where I was newly elected was disabled. I was not allowed in the building. My son-in-law was fired from his job. And I remember going to a local protest. I didn't come down to Olympia for the protest, but there was a local protest where my local nurses and some of the firefighters were protesting this vaccine mandate. They felt that they were being coerced into taking the vaccine. And these are educated people, these nurses that I was picketing with, literally picketing with. And they had decided that this vaccine was not for them. And they wanted to be heard. Well, it ended up, I knew a couple in my church that the woman is a nurse and the husband's a firefighter. They both lost their jobs at the same time over a health choice that they made. Madam Speaker, we have got to do better than that. We've got to have freedom to make our own medical choices. We should not have vaccine mandates. We should not mandate any medical treatment. People should be free to make their own choices.
The good member from the 49th, Representative Stonier. For what reason do you rise?
Thank you, Madam Speaker. I'm hoping we can encourage members to stay focused on the policy that is impacted by the amendment, which is information coming from public health experts.
The amendment before the body relates to the prohibition of state and local governments from requiring any individual to receive any immunization or vaccine. The point is not well taken. The member may proceed.
Thank you, Madam Speaker. And that was just my point, is that we should not be required to take vaccines or any other medical treatment. A vaccine, I consider that a medical treatment, Madam Speaker. I'm pretty careful what I put in my body. So we should be free to make our own decisions. And by allowing people to be free to make their own decisions, we will move forward innovation instead of being stuck in technology that may or may not be the best practice anymore. So I urge a yes on this amendment. Thank you.